Hello everyone, I am Dr. Shreyas Ramamurthy, Consultant Cornea, Cataract and Refractive Services at the Eye Foundation Group of Eye Hospitals. Today, I will be talking to you all about the various options that we have in LASIK surgery. So, LASIK surgery is essentially performed to correct different powers in the eye. We can correct myopia, we can correct astigmatism or cylinder powers, and we can correct plus powers or hyperopia as well. Now, let us just talk about how LASIK surgery is performed and what are the options that we have. Now, if you assume this to be your cornea, in LASIK what we are doing is we are creating a flap and then doing the laser on the bed and placing the flap back. Now, this flap can either be made with a blade or it can be made with a laser itself. Making the flap with a blade was the older technique or the original technique which came about almost 3 decades ago. We still have that technique and it is still available, but the repeatability and accuracy of the technique is low. Essentially, because our control with the blade is lesser, there can be occasional complications like flap tears and buttonholes and flap folds. Now, we also have a laser called the femtosecond laser, which is what is commonly referred to as the bladeless LASIK, where essentially we are creating this flap with a laser. Because we are creating this flap with a laser, we have absolute control over this flap making. We can assess the depth of the flap, the diameter of the flap, the position of the flap. And even while doing the procedure, if we need to adjust any of these, we can stop, make adjustments and continue with the laser procedure. Such is the control that the femtosecond laser machines give us that we are able to ensure 100% consistency and repeatability in the results. An advancement even in this is what we call SMILE. In SMILE, instead of making it an invasive where we create a flap and then treat on the bed, all we do is just create a small pocket. This pocket is hardly 2 to 3 millimeters in size, and through this pocket we just remove what we call a lenticule, which is essentially the power which needs to be removed from the eye. This power or this lenticule is fashioned by the SMILE laser itself and then is removed through that small pocket. It heals immediately and provides excellent quality of vision on day one itself. The latest advancement in this field is also called the Contour LASIK. What Contour LASIK does is essentially it maps our front layer of the eye or the cornea and it procures 22,000 points of different data points on our cornea. These data points are then transferred on to the laser machine and the laser machine then modifies the treatment algorithm according to this data from these 22,000 points. And each laser profile, ablation profile is customized to that cornea, to that particular cornea of that patient. Therefore, providing exceedingly consistent, reliable and accurate results. Thank you so much for your listening.